For years, Odisha has been a hub of malaria. In 2007, Odisha reported 366,000 cases of malaria. Around 50% of malaria deaths in the country were reported in Odisha, especially in southern districts where the disease has been found to be endemic. The most fatal of all malaria species is Plasmodium falciparum, which is life-threatening since it directly hits the brain. The Tata Trusts, in partnership with NGOs, initiated the community-based malaria control and prevention program. In these inaccessible areas, the project focused on studying the dynamics of malaria, how it occurs, who the players are in order to prevent and control malaria in the community.
For us as a community, as people, malaria is not just a medical issue. It is an economic issue, it is a social issue, it is a political issue. The predominant vector in this area is a mosquito called Anopheles fluviatilis. This one breeds in slowly flowing stream and prefers to bite peri-midnight. Therefore, your strategy would need to be designed for Anopheles fluviatilis.
With the support of Tata Trust, we try to enhance the knowledge level of the community. We actually took 4 questions. What is malaria? What are the symptoms? What to do if you get malaria? What to do not to get malaria?
Communities themselves have played an important role in scaling up the program by participating in awareness campaigns and training. The project has also ensured that families can now live in safe households by mosquito-proofing their hutments to prevent being bitten by the mosquito. Mosquito bed nets are also being distributed so that their homes are malaria-free. Regular camps are held at the village level, where volunteers weigh newborns and infants, and they are tested for the nutrition status, and blood tests are also done for malaria routinely.
So we've started saying all under 5 children during the malaria season, when they are likely to die, because most of our malaria deaths are during the season, June to November. During this season, every child in our area should have a blood test, with or without fever. So the first year we did this, we found on an average across 5 districts, there were about 40% of children under 5 were positive for malaria with or without fever.
कि जदि गाँव स्वास्थ्य समस्या विषय जदि किसी गोटे छोट छुआ के जदि ज्वर है कि कौन है बेला एटा रेफर भी करा जाउची
आगुरु ज्वर है आज्ञा से गुरु गुनिया के डाकुथिले आ एबे ज्वर है आज्ञा एबे आशा दीदी पाखरो जाइकिना से ब्लड टेस्ट करकिना एटा औषध आनी कर खाइबार पड़े मासे के गुटे तोर मासे के 2 तोर 3 तोर जाउथिलु ई एबे केते वर्ष 2 वर्ष हेउचे टिके कमी
Following the project's success in reducing malaria deaths in the program areas and empowering communities, the government has taken a call to take the malaria program forward.
In the highly endemic districts, we have selected 8 districts. We had recently a meeting chaired by Honorable CM, which is the State Health Mission, where this has been approved in principle. And after we get all the approvals, we'll need money, additional money from the state plan, which I think should not be a problem.
We are also engaging many stakeholders with us, and one important stakeholder is with us, the Tata Trust, who have come in, are interested to work with the government of Odisha and in most inaccessible areas in southern Odisha.
We have been able to build evidence and generate evidence through simple, good quality program. It really has the potential to be taken to scale, and I'm happy to say that Government of Odisha is actually thinking about taking it to scale. Objectives for us is to see how we can make it sustainable. We should be able to see in what way technology can play a role so that we can strengthen the surveillance mechanism.